Hello, this is Dr. Mohammed Rahman, RHMAN, board certified in internal medicine since 1997, owner at Saireen Medical Group, and currently medical director at Forest Hill Care Center in Queens, New York. I am also an attending physician at Northwell Health, Forest Hill Hospital, Forest View Nursing Home, and Park Terrace Care Center for over 20 years. Today, I'm presenting what we believe to be a potential breakthrough in the fight against COVID pandemic. My team and I have tested a therapeutic combination that we believe may dramatically decrease the mortality and morbidity rate of COVID-19 based on our trial conducted in nursing homes, hospital, and on outpatients. This combination has resulted in zero COVID-related deaths, prevents development of severe long-term symptoms, and does not sacrifice patients' health the way other reported treatment have. Additionally, the combination uses widely used FDA-approved drugs that have little or no side effects. Typically, the cost around $30 or less for a 14 days outpatient treatment course. The purpose of this presentation is to provide guidance to treating physicians and patients who seek advice from their physician. Additionally, we hope other medical groups and researchers pursue further study of our proposed combination. In this video, we will discuss what our latest combination is, how it prevents the progression of COVID-19, how our patients reacted to the combination, and the exact treatment protocol we recommended for those who test positive for COVID-19 for both inpatient and outpatient settings. Our combination consists of mainly 6 medicines that fall into one of 2 categories: immunomodulators and essential drugs, and also adjunct therapy with anticoagulation was used when applicable. Immunomodulators are common over-the-counter drugs that help enhance the immune system's ability to fight infectious disease. The immunomodulators in our combination are vitamin C, vitamin D, and zinc. These essential drugs work to block the progression of COVID-19 once it enters the body. The essential drugs we used in our study are azithromycin, famotidine, and montelukast. We also used anticoagulation when applicable as an adjunct therapy. We'll discuss the exact recommended doses of each drug later in this video. First, I'll explain how we believe each drug may help treat the COVID virus as part of our combination. Vitamin C, vitamin D, and zinc all work in concert to boost the effectiveness of immune cells against viruses in the body. Some studies shows that they may block viruses from entering the cells as well as inhibiting further replication. Azithromycin prevents viral replication, shows an immunomodulatory effect, reduces production of pro-inflammatory cytokines, and helps prevent additional secondary bacterial infection. Famotidine is an antihistamine and protease inhibitor which may prevent viral replication. Montelukast has been shown to have an effect on ACE receptor inhibition, as well as anti-inflammatory effect with bradykinin and leukotriene antagonism. As COVID-19 enters into the cell via ACE receptors, montelukast may block entry. Bradykinin and leukotriene antagonism blocks the inflammatory cascade, which may prevent cytokine storms. Anticoagulation, which is typically part of standard care in hospital and nursing homes, helps prevent cardiovascular events such as stroke and blood clot. While individual effects of these medicines cannot fully treat COVID-19, our theory is that the combined effects of all medicine together may have prevented morbidity and mortality in patients in our trials. Our study was done in 2 phases. We took any patients that reported positive for COVID-19 and did not pre-select, and there was no selection bias. The model of the study was intention to treat. Our outpatient group was contacted daily while in treatment and once weekly for 4 to 6 months post-treatment. Nursing home and hospital data was collected by reviewing patients' record during the treatment phase, and weekly follow-up were done after that to monitor their progress. Phase 1, we had combination of azithromycin, famotidine, and immunomodulators, plus prophylactic subcutaneous enoxaparin in nursing home only. There are 28 patients in this group. 10 patients were in Forest Hill Care Center, 18 outpatients in my practice. Age group range was outpatient between 24 to 74, inpatient 50 to 99. Body mass index range, outpatient was 21.6 to 35.7, and inpatient was 15.7 to 34.9. 3 nursing home patients developed pneumonia. One of them went to hospital but came back after 2 weeks of treatment. There was no mortality. Nursing home patients were back to baseline in average of 12 days. Patients in outpatient trial went back to baseline 7 days on average. While these were strong results, 3 patients in the nursing home still developed pneumonia, and the overall recovery timeline was longer than we hoped for. Then we found out about the potential effect of montelukast based on other COVID research, and we added it for our phase 2 trial. It was a combination of azithromycin, famotidine, montelukast, and the immunomodulators, vitamin C, D, and zinc. There were 38 patients altogether in phase 2. The age range of the patients, outpatient between 19 and 87, inpatients 79 to 88. Body mass index range, outpatient between 20 to 37.9, inpatient 25.2 to 29.9. 32 out of 38 patients were high risk by their age, body mass index, and/or underlying medical conditions. Let me give you some notable example of the patients we treated in that group. Outpatient, 65-year-old with diabetes, hypertension, and pancreatic cancer on chemotherapy. 76-year-old obese, COPD, diabetes, coronary artery disease, and sleep apnea. 82-year-old with asthma, diabetes, hypertension, coronary artery disease. 65-year-old with congestive heart failure, ejection fraction of only 25, diabetes, chronic kidney disease, atrial fibrillation, and coronary artery bypass graft. Let's talk about results now. Zero complication developed, zero mortality. Patients were on average back to baseline within 3 days with significant symptomatic improvement. One was treated in the hospital with pneumonia, altered mental status, diarrhea, and fully recovered with radiographic resolution of lung infiltrate within 2 weeks. Two patients treated at Forest View Nursing Home with COVID pneumonia and mild hypoxia. Hypoxia was resolved within 2 weeks and radiographic resolution of the lung infiltrate in 19 days. The results of phase 2 were very strong in terms of both preventing mortality and sharply reducing morbidity. Individually, the drugs have some positive benefits, but do not provide full protection against the worst symptoms of COVID, which include lung damage and pneumonia. However, we found that the combination of azithromycin, famotidine, montelukast, vitamin C, vitamin D, and zinc seems to provide maximum protection against COVID-19 when used together. Based on our two-phase study and research on other COVID-related studies, we are proposing the following treatment protocols in inpatient and outpatient settings. Please note, this protocol has not been approved by any scientific authorities. Let's talk about inpatient protocol. We divided the inpatient into first nursing home and adult home. The treatment duration will be 4 weeks. The immunomodulators, vitamin C 1000 mg a day, vitamin D 5000 unit per day or 50,000 unit a week. Zinc sulfate 220 mg per day or zinc gluconate 50 mg per day. The essential drugs, azithromycin 500 mg once a day for 5 days, famotidine 40 mg twice a day for 1 week, followed by once a day for next 3 weeks. Montelukast 10 mg twice a day for 1 week, followed by once a day for the next 3 weeks. And anticoagulation prophylaxis as per facility protocol. As per the hospital, the duration of the treatment is also 4 weeks. Let's discuss that in details. Vitamin C, 1000 mg a day. Vitamin D, 5000 unit daily. Zinc sulfate, 220 mg daily. Should be given intravenously if available for 1 week, followed by either intravenous or oral for the next 3 weeks, depending on the patient's response and oral intake. Azithromycin 500 milligram intravenous once a day for 5 days, and famotidine 40 milligram intravenous twice a day for 1 week, followed by either intravenous or oral for next 3 weeks, depending on the patient's response and oral intake. Montelukast 10 milligram twice a day orally, as there is no intravenous form available nowadays, for 1 week, followed by once a day for next 3 weeks. If patients has low oxygen level and requires oxygen supplementation, the treating physician may consider adding dexamethasone intravenously as per recovery study. And once again, anticoagulation prophylaxis as per facility protocol. Now let's talk about outpatients, where most of the patients are. Before we talk about our patient's protocol, let's first discuss COVID related symptoms as per the CDC, Center for Disease Control. The symptoms may appear between 2 to 14 days after exposure to the virus. People with these following symptoms may have COVID-19. Those include fever or chills, cough, shortness of breath or difficulty in breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Just look for emergency warning signs for COVID-19 patients. If someone is showing any of these following signs, please seek emergency medical care. Trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face. Now let's talk about the full outpatient treatment for the COVID-19. The duration of this protocol is 2 weeks. Immunomodulators, vitamin C 500 milligram once a day, vitamin D 5000 unit once a day or 50,000 unit once a week. Zinc sulfate 220 milligram once a day or zinc gluconate 50 milligram once a day. As for essential drugs, azithromycin, which is commonly known as azithromycin pack, 250 milligram, 2 tablets on the day 1, followed by 1 tablet every day for next 4 days. Famotidine 40 milligram once a day for 2 weeks, and montelukast 10 milligram once a day for 2 weeks. Let's divide the recommendation as per age group. 60 year and older, which are the most highest risk patient population, whether they are symptomatic or asymptomatic, should have full protocol for 14 days, along with immunobooster and the essential drug, plus coated aspirin twice a day for 14 days to prevent any cardiovascular event. Age group 45 to 60. Asymptomatic, only immunomodulators, that means vitamin C, D, zinc, and quarantine for 14 days. If they are mild to moderate symptoms, we'll use the full protocol for 14 days plus coated aspirin twice a day to prevent cardiovascular event like COVID stroke or COVID heart attack. If the patient is under 45, if they are asymptomatic, only immunomodulators, that is vitamin C, D, and zinc, and quarantine for 14 days. Also, if there is mild symptoms in this age group, then only immunomodulators, that is vitamin C, D, and zinc, and quarantine for 14 days. If patients are less than 45-year-old and they have moderate symptoms, they should be treated with full protocol without aspirin. That means they should be treated with the immunomodulators, vitamin C, D, zinc, plus azithromycin, famotidine, montelukast, but no aspirin. And make sure anyone with severe symptom should go to the nearest emergency room immediately and seek medical attention. In conclusion, we are cautiously optimistic because this is a very affordable and side effect free treatment protocol that has been effective at preventing morbidity and mortality in our studies. Although our results thus far have been extremely promising, we are not claiming that this combination is a magic bullet. As I mentioned before, our goal is for more medical professionals and researchers to test the validity of this combination to promote the health of millions of COVID patients worldwide. And remember, prevention is always better than cure. So please continue to wear a mask in public and practice social distancing when appropriate. Please share this video and leave any questions you may have below. Stay safe and healthy. Thank you.